I'm Amanda Johnson. I'm the executive director of the ASXL Rare Research Endowment Foundation. We're a patient advocacy organization for the three ASXL-related disorders with a parallel path mission to support families where they are now while we build the path to treatments and improvements in medical care. So today we have a nice conversation between Sarah Scott and Karen Ho, two members of our staff, to focus on where we are in understanding the path to treatments. And before we start, I'll just mention that everything that you'll hear today will apply to all three ASXL-related disorders, Bohring-Opitz Syndrome, Shashi-Pena Syndrome, and Bainbridge-Ropers Syndrome. So I'll turn it over to Sarah to take it from here.
Thanks, Amanda. I'm Sarah Scott, and just like Amanda said, I'm the Family Engagement and Education Coordinator for the ARRE Foundation. But more importantly, I am mom to Sammy, who has Shashi-Pena Syndrome, ASXL2. And today I'm going to be talking with our foundation's Chief Scientific Officer, Dr. Karen Ho, about where the ASXL community stands in the pursuit of treatments for ASXL-related disorders and the ARRE Foundation's role in these efforts. So Karen joined the ARRE Foundation's team back in April of 2025, and she brings a wealth of knowledge from her experience as a scientist and as a drug developer. Um, as you guys know, we are seeing more and more stories about children receiving genetic therapies, and a lot of parents are wondering, when is it my child's turn? So let's explore what's possible now, what still needs to happen, and how our community can help move science forward. So my first question for Karen is, Karen, what is the outlook for treatments for ASXL-related disorders?
Thank you, Sarah, for that lovely introduction. It's exciting to live in a world where the promise of treatments for genetic conditions actually exists. There were no approved gene therapies 10 years ago. Today, there are real-world examples of successful treatments that tackle the underlying genetic cause of some very serious conditions, like sickle cell anemia or spinal muscular atrophy. We're even starting to see some early trials for treatments in other neurodevelopmental orders, which is really exciting. The major challenge for finding treatments in ASXL-related disorders is that we still don't yet understand exactly what each ASXL gene does, nor do we understand exactly what goes wrong when one copy of that gene is mutated. So we've got some slides to help illustrate this point. Let's pull them up. So as you know, there are two copies of every gene in every cell of our body. And as you can see on the left in the yellow box, there are two copies of, let's say, an ASXL gene, and those two copies are making normal amounts of ASXL protein, shown in orange. Now, here's the unanswered question. What happens when we mutate a copy of that ASXL gene that we show on the right-hand side of the screen now in the blue box? We've got a little X on the mutated copy of the gene, and the question is, what happens with that mutated copy? Well, there are a couple of scenarios, and these scenarios are based on what we know from mutated copies of other genes. So the first scenario is we have one normal copy of an ASXL gene, and we have a mutated copy of that gene, and it's producing mutant protein. And that mutant protein is not functioning like the normal protein should. Or we have scenario two, where we have a normal copy of an ASXL gene and a mutated copy of an ASXL gene, and that mutated copy, for whatever reason, is not producing any protein at all. So in essence, we have normal protein being produced, but there's not enough of it for the cell to function normally. So in these scenarios, there are a couple of things that we could think of as scientists to try to begin to make the situation better. In scenario one, when we have mutated protein being produced, we can try to use methods to eliminate or lower the level of that mutant protein, because we know that mutant protein may be messing up some of the functions of the cell. The other strategy that we could use in this scenario is to raise the level of normal protein so that now we have enough normal protein to do normal functioning, and we've also gotten rid of the mutant protein, which is messing up the works. Now, in scenario 2, the situation's a little clearer. Since there is no mutant protein to have to get rid of, all we need to do is raise the level of normal protein to normal levels so that the dose of that normal protein is correct and the protein can function normally in the cells. So those scenarios actually are becoming reality. We have genetic therapies and we have molecular medicines that can do just those things that I just described. Of the molecular medicines down below, you could see that we've got small molecules in that category. Those are like the pills that we can take orally, some of which, for example, we use as anti-epileptic drugs. And in the genetic therapy category, we have antisense oligonucleotides, or ASOs. We have CRISPR editors. We have gene replacement therapies. And there's actually more that could be added to that list that are in development. And what can all of these therapies do? They can actually enhance gene function. So like I showed in the previous slide, sometimes we just need to boost the level of the normal protein. They can inhibit gene function or get rid of mutant protein function, for example. They can correct the negative effects of a faulty gene, or they can even go in and correct a mutated gene sequence.
So, why is understanding the disease mechanism important before creating treatments?
That is a critical question. Why is it important to understand mechanism before we treat the disease? We need medical research because we need to be able to match the right therapy to the problem that's being presented. So let's, for example, say that I have a car that won't start. I actually know very little about cars in real life, and so this is a great example. My car's not starting and I don't know why. And a car is a complicated thing. So there are many, many reasons why the car might not start. I actually have a toolbox at home too, and I've got lots of tools in that toolbox. But if I don't know why that car is not starting, I could use the wrong tool to fix the wrong thing or take out the wrong thing, or actually do more damage to my car than was actually initially the reason why it wasn't starting in the first place. And the same goes for trying to create the right therapies to match the right problem that we're trying to fix in a disease state. We need to be able to choose the right therapy in order to address the right problem. Do we want to upregulate a gene, for example, or do we don't want to downregulate the mutant copy of that gene?
So, what is the ARRE Foundation doing to move us toward treatments?
The ARRE Foundation is going to make a significant scientific investment in research in the coming years. And these investments are going to make crucial differences in our understanding of what the ASXL genes normally do. We will then be able to also understand what goes wrong when one copy is mutated. We will be busy building the cellular and animal models needed for drug development. And while doing all of that, we'll also be continuing the ongoing support of clinical research that is ongoing now and that we are so grateful that our community participates in. So these are crucial investments in research. And as everyone knows, research takes time. It might not happen all in 1 year, but we are making a significant investment in order to accelerate our understanding of the ASXL genes so that we can get there faster.
And what can ASXL families do to support progress towards treatments? Families, this is where we need you to be involved. How can you help us move towards therapies and better care for our kids? Number one, give funds or raise funds for research. Um, we cannot do what we need to do in science without funding, and we need your help. Make a donation yourself. Ask your friends and family, ask your colleagues. We need as much help as possible. And also, please participate in research. If you haven't already, get your child enrolled in the natural history study, the ASXL-related disorders natural history study. We need your child's information to be able to study these things and to get the answers that we so desperately need. And if you're comfortable, contribute a biological sample so that we have the samples that we need to do the research to make the progress. And this is a really exciting time. There is a lot of hope for our kids, and we need your help. And finally, thank you so much. Thank you. You can visit the ARRE Foundation's website at arrefoundation.org to get more information. And feel free to contact Karen with any questions at karen@arrefoundation.org or myself, Sarah at arrefoundation.org, and we would be happy to answer any questions that you have. Thank you so much.
Thank you.